presented this result at ASCO GI, and the comparison between both therapy, Nivo plus Epi versus Nivo, met the endpoint. The study is positive. The hazard ratio is at 0.62, and the p-value is significant at 0.003, and it's clearly a better efficacy of the combi versus the monotherapy, with 71% of patients without progression at 2 years with the combi versus 56% with monotherapy, with better response rate, 71%, amazing response rate in this situation with the combi, compared to 68% with monotherapy. And the very important point is the fact that all subgroups benefit of the combi compared to mono, and for this reason, the efficacy of the combi is the conclusion of this trial, and make of this combination of a new standard. Different. The combi is more toxic, with more grade 3-4 mediated treatment-related adverse event. It's 22 versus 14%. More discontinuation with combi compared to mono. It's 14 versus 6. It's also most immune-mediated adverse events, grade 1 or 2, but also grade 3 and 4 occurring, but in a very little number of patients. It's 5% of the patients, and higher incidence of immune-mediated endocrine adverse events with combi compared to mono. Majority grade 1 and 2, manageable using established protocols with or without the need for ongoing hormone replacement therapy. It's clearly more toxicity, but it's clearly a balance. The balance between efficacy and toxicity is, in my opinion, in favor of the combi. This can change depend, because in US the situation is different compared to Europe or to Asia, but clearly this data plays the combi as a standard of care in this situation. Next step will be to analyze overall survival data, to analyze also the comparison between Nivo and chemo, because it was not done at this time. It was not it's a secondary objective of the trial. Also to see, because it's the result I presented, it's for all lines, to see the results only in first line, comparing Nivo Epi versus Epi. I think it's a lot of new things to discover with time with this study.